Hi, this is Bryce Taylor of Downtown PT and creator of the Halo Trainer. Today I want to look at the burpee. We're going to look at the anatomy of a burpee and dissect it into its component parts. And I want to address it by its movement descriptor, which is a squat to plank. There are 4 parts to a burpee, if you want to call them phases. There's 2 squats, there's an upright phase, and there's a plank phase. We're going to look at the complex multi-joint loaded movement pattern and break it down and show you common movement faults, and we want to show you some upgrades that are available, such as adding in a push-up, changing the depth of the squat or the jump, and show you how the Halo Trainer will help with ergonomics and that mitigation of the risk of injury when addressing common movement faults. So as we layer in the speed and stability challenges, I hope you really enjoy this dissection of the burpee.
Here we're looking at the common burpee from the front view. From the side view, we can really appreciate the 4 phases of the burpee: a squat, a plank, another squat, and then the upright position. And here we can see a progression into a plyometric jump at the top, and then into a change in elevation and a push-up at the bottom from the front and side views to get the full appreciation of the anatomy of a burpee. As we slow it down, we're looking at a common movement fault, which is valgus collapse at the knees as the knees come together. And again, in the plyometric phase, we see valgus collapse. From the side, we're seeing a bent over torso, a little bit extra kyphosis, if you will, of the spine, and here going up onto the toes. And more common movement faults we can appreciate from the side view is collapsing of the hips down toward the floor, or raising up into a pike position as he's shortening the lever there. Another one is scapular retraction, where the shoulder blades fall together. This faulty movement pattern we might see in the upright phase is excessive translation of the hips forward over toes, and lordosis of the lumbar spine, which is arching of the lower back as the arms come up. Here we're introducing the Halo Trainer. This allows for a more biomechanical squat phase of the burpee, and adds a little external load at the top in the upright phase. But you'll really appreciate from the side view that upright torso stays in line with the tibia, with the lower leg, and we can move into a plyometric jump and push-up. You might appreciate also the ergonomic handlebars, which allow neutral grip instead of trying to reach to the floor, which is another 12 inches down, and going into wrist extension. Here we're breaking down the squat phase with the Halo Trainer, one reaching to the Halo Trainer on the floor, and then in the second one we're showing the Halo Trainer actually reaching to the floor. Even with the biomechanical advantage of the Halo Trainer, we have to watch for valgus collapse. Here we're expounding on the plank phase, and we're looking at a step out and then a jump out. And notice the ergonomics of the handlebars. The wrists are in a neutral position, and we can really appreciate the upper core stabilization required for the thrust, that transition. As we see the plank phase from the side, we can see the increased depth available with the Halo Trainer. As we break down the upright phase, it requires abdominal engagement in order to not go into the excessive lordosis or the anterior hip translation seen in the faulty movement pattern. And finally, here's a comparison between the squat to plank with and without the Halo. Notice that with the Halo, there's a better biomechanical squat when going into the squat phase from the upright and back from the plank into the squat once again.